Let's take you back to federal politics now. Joining me from Canberra is the Minister for Families and Social Services, Paul Fletcher. Minister Fletcher, good morning. Thanks for joining News Breakfast.
Good morning. Good to be with you.
Minister, do you know anyone struggling to get payments from the NDIS? Well,
I certainly receive issues raised with me from time to time about the NDIS. It's a massive scheme. There's over 250,000 participants, and of course there'll always be issues from time to time. But in terms of providers, what we announced just last week is $850 million more to be spent in 2019-20 through an increase in the prices that can be paid to providers. That's things like the hourly rate for a personal care worker or the rate that gets paid for a physiotherapist or an occupational therapist. So, in fact, more money being injected into the scheme, and the amount that participants have in their plans will automatically be increased to provide for that those price increases.
Although, as Laura Tingle explained to us some days ago about the sleight of hand around this, when you've got an underspend being a total reduction of $6.5 billion over 2 years, that ain't much comfort, is it?
Well, let's be clear. The amount being spent on the National Disability Insurance Scheme in 2019-20 will be almost $18 billion.
Not talking about the total, talking about the underspend.
Will be a $4.5 billion increase on what was spent this year, 18-19. So we're spending much more in 19-20, not less. $4.5 billion more is being spent. Now, this is a demand-driven program.
So are we going to dance around this morning about the underspend, are we?
This is a demand-driven program, and so what happens is, as the numbers in the program vary, you make adjustments, as routinely happens in the budget process. Can I make the point that in another part of the budget, there's a $1.9 billion increase over 4 years in public hospital spending, because there's been an upward variation in demand. Now, what's happening in the NDIS is that the bilateral estimates agreed between the Commonwealth and the states and territories are that we'll get to 460,000 participants at so-called full scheme. We're at just over 250,000 at the moment, and we're a little bit behind where we thought we would be. The bilateral estimates, by the way, go back to 2012-13, so it's not surprising there's some variation. And what we've done is made an adjustment in the budget, as is typical for demand-driven programs. But I make the point, the money is there for any participant. Australians can have confidence that the NDIS is fully funded.
But the demand, I have to jump in there because I can actually hear from around Australia those people who are desperate to get into the system, but the bottleneck that exists in the system won't let them in, saying and screaming at the TV, that's the demand. The demand is there, but you've got a cap on staff, you've got a problem with staffing.
Well, Virginia,
and therefore, let me finish my question, please, Minister, and you can answer it. It's the same issue, Minister, and that therefore they can't get into the system and can't get what you say you've apportioned to it.
No, Virginia, that is just simply not right. So we have a process to get people into the scheme to be assessed for eligibility, and once you're in the scheme, then the next step is to have your plan.
But that's the point. Once you're in the scheme and the plan is put in place, people are waiting months for their plan.
Well, the average is about 90 to 100 days to have your plan finalised and determined.
And that's acceptable to you, the average? So we're talking an average here of 3 months, right? But then that extends out to 6 months and longer for others. That's acceptable.
The plan process is one where the participant sits down with their local area coordinator, works through their specific needs.
We know what the planning is.
And at the end of that process, then the plan is determined and the funding becomes available.
We know that, but the planners aren't making contact because they're understaffed and there aren't enough.
Well, there's around 10,000 people around Australia,
but they're not enough, Minister. There's a staffing cap.
Who are working to deliver services under the National Disability Insurance Scheme. Of course, there will always be instances where there are individual cases where the outcomes are slower than they should be, and we
to the tune of $1.6 billion.
But we're doing a lot of work to improve the participant pathways. This is the way that somebody comes into a scheme. So we've got a complex needs pathway. We've got an early childhood, early intervention pathway. So that's for children with autism or with hearing disorder, where you want to get treatment as quickly as possible so that a young child with a hearing disorder may well be put in a position where they can go into a standard school.
Minister, we know that the system is too slow. As you've just conceded, an average wait time of 90 to 100 days. No treatment, no access to that school. What are you as Minister going to do about that?
Well, what we are doing is continuing to work on improving the participant pathways, improving the services. We've improved the website. We've made a lot of changes to the whole participant process. The average time for somebody to come into the scheme when they're transferring across from coverage under an existing state government scheme is now only a matter of days. That's to come into the scheme. Obviously, then we need to determine the plan. But so we are continuing to improve the performance that people experience as they come into the scheme. But can I make the point that has nothing to do with a routine variation in the budgeting process. The funding is there for everybody who's in the scheme. Australians can have confidence that if you're eligible to be covered by the NDIS, the funding is there, the scheme is fully funded, and it's because of our strong management of the budget that we are able to give that commitment.
Let's get through some other quick issues if we can. More people are soon going to be allowed to leave your controversial cashless debit card trial because changes passed to that through Parliament last night. It's being trialled, of course, in South Australia, West Australia and Queensland. Why did the government support the Labor amendment?
The cashless debit card trials that are presently operating, 3 of them have legislative authority to operate until 30 June of this year. As a result of the changes that have now gone through the Parliament, that will now extend for another year. That's important because we need to continue to assess the experience under the trials. Under the cashless debit card, 80% of your welfare payment goes onto a card which can be used to buy anything except drugs, alcohol or gambling related products. And the feedback on the ground, and I've been to towns where it's operating, Kalgoorlie, Leonora, Laverton, when a senior Aboriginal community leader says to you, this is so important for our people, when the police say we're seeing fewer call-outs for domestic violence, when a chemist says to you, parents are coming in to buy medical and other needs for their children because they've got the money to do that now, when people say their streets are safer, the case for the cashless debit card is strong.
Sure, but I just have to jump in there, sorry to do that because time is on the wing, but you extended the trial, but it also does allow people to exit the system and more of them. So if that's something that's acceptable to the government, then why wasn't it part of the scheme in the first place?
There was an amendment that Labor proposed that we've agreed to. That's
right, and my question goes to why?
Which would allow a process under which somebody who can demonstrate that they have their finances under control and they can demonstrate that to the satisfaction of what's called a local community board would have the opportunity to exit the scheme. That's a change that Labor proposed. We thought that was reasonable. We're prepared to agree to it. We think it's important the trial continues. And I'm sure you'd agree, Virginia, that it's a good thing that the two sides of politics can work together in a constructive fashion to agree outcomes.
It's not for me to agree to anything, but I just wonder why, if you've got a scheme that actually wants to be trialled in this way and quarantine money, why then you'd agree to an amendment you didn't have in the first place to allow people to exit that apparently good scheme?
Well, because there's a process under this provision that would allow somebody who could demonstrate they had their finances under control and met a range of other criteria to apply to exit from the scheme. It was an amendment that Labor put. Our judgment was that it was an amendment that was workable. We've agreed to it, and the consequence is that the cashless debit card trials will be continuing in Kalgoorlie and the Goldfields in Western Australia, in the East Kimberley and in Ceduna.
Minister Fletcher, just finally this morning, and this really seems to be a lightning rod issue at the moment and one that's going to resonate through the looming election. When will the government increase New Start?
Well, it's important to understand that New Start is intended to be a temporary payment to assist people back into the workforce. Around 2/3 of people are on New Start for less than a year. It's also important to understand that 99% of people who are on New Start are also receiving other benefits such as the energy supplement or Commonwealth rental assistance, and all of that reflects the fact that this is designed to support people back into the workforce. Our policy is to get people back into the workforce. There are 230,000 fewer people of working age who are on income support, who are on welfare today than when we came to government. The percentage of people of working age who are on welfare at 14.3% is the lowest it's been in 30 years.
So is that a long way of saying that you won't? We'll have to bring our conversation to a close.
What I'm saying is our focus is getting people off of New Start into the workforce. We've created 1.2 million jobs and we're having considerable success in getting people into the workforce. Everybody who transitions from welfare to work achieves a personal victory, and it's also important for the nation.
Minister, thanks for joining us today.
Thank you.